Welcome back to Pharmacy House. Today we are studying more scenarios for the Pharmacy Oral Exam Part B, which is Legal and Ethical Practice. These videos are designed to complement your learning as part of our intensive oral exam package. For more information on this, check out our website using the link in the description below. Today, we'll be focusing on a scenario where you, as the pharmacist, receive a prescription for oxycodone from a new customer. The prescription appears to be valid and has been written by a licensed physician, but something doesn't feel right. You suspect they may be doctor shopping. What do you do in this scenario? When tackling this question in the exam, remember that you'll have 5 minutes to answer. We recommend pausing the video here and timing how long it takes you to respond. Now let's break down the recommended approach to answering this scenario. So, let's begin by identifying the legal and ethical issues at play. In this case, if the prescription meets the state requirements, it is legal to dispense it. However, if you suspect the patient may cause harm to themselves, then it is your ethical duty to act according. Now, how can we best handle this situation? In this scenario, it's crucial to balance legal and ethical responsibilities. Here's a suggested course of action. Step 1. Verify the prescription, ensuring it meets all legal requirements. Check for any obvious irregularities, such as forged signatures or missing information. Step 2. Contact the prescribing physician for clarification and to confirm the patient's medical need for the medication. In some states such as NSW, it is a legal requirement to contact the doctor if you do not know the patient, prescriber, or the prescriber's handwriting. There is also a component of ethical duty to ensure patient safety. Step 3. If available in your area, to check the patient's S8 prescription history via real-time prescription monitoring through softwares such as SafeScript in NSW or Dora in ACT in Tasmania. This can help identify any suspicious patterns of seeking multiple prescriptions. Step 5. Exercise your professional judgment. If you believe there's a genuine medical need for the medication and the patient is not engaged in drug-seeking behavior, you may fill the prescription while documenting your actions and concerns. You may also consider refusal. If, after thorough evaluation, you still have concerns about the prescription's legitimacy or the patient's intentions, you have the legal right and ethical responsibility to refuse to dispense the medication. Explain your decision to the patient in a professional and compassionate manner, and provide them with alternatives on how to address their medical needs more appropriately. Lastly, remember that protecting patient health and safety is paramount, but it must be done within the bounds of the law and professional ethics. If you ever feel uncertain or uncomfortable in such situations, seek guidance from experienced colleagues or legal experts to ensure you make the right decisions. Have some sort of a structure in place to help you excel. This is the key to passing the communication component of the exam. At Pharmacy House Australia, our pharmacists will provide you with one-to-one tutoring to not only help you pass the oral exam but make you confident pharmacists. Remember, around 50% of the oral exam is communication, so it's important to dedicate some time to this. Also, have a think about these follow-up questions and how you would respond if asked by the examiners. Now try answering this scenario. What factors do you have to consider? What would you do if the medication was simvastatin versus amoxicillin? How about if the medication was Symbicort inhaler? Who are the stakeholders involved and who would you contact? Pause the video here and take 5 minutes to write your answers in the comments below. Now remember, you want to clearly explain the legal and ethical considerations, justify your actions, and communicate clearly throughout your response. By following these steps and incorporating the key elements we discussed, you'll be well prepared to tackle this section of the pharmacy oral exam. For one-to-one support, reach out to us at www.pharmacyhouse.com.au, and good luck with your pharmacy journey.